Hello students, we will discuss today ingredient which is used to treat many wounds, which was used in many countries. We still use in our country because of some drawback. It is banned in many countries. But still, it is quite useful when you use it for short period, not long period. That's the point. Is very important. So what is it? It's mercurochrome, often called as merbromin solution also. So find out when it is, just see, go through the slide, when it is invented, how it looks like. See that red color it is. Very cheap solution. It increases the epithelialization and it's local antiseptic also. For wounds also they were using earlier. And it contains mercury and bromide. So it is invented in 1919, Hug White Young, 100 years back, more than 100 years back. 2% anionic solution. When applied with the dilution with water, it is soaked in cotton, gently applied. It's locally antiseptic and it is said to promote epithelialization also in a raw area and also in a grafted area, in a recipient bed. So this is what it is, in the recipient bed it is used. In a raw superficial raw areas of the skin, it is used to as a local antiseptic, it's an anionic solution, and also it is to a certain extent promotes epithelialization. The important thing is don't use for a long time, only for a few weeks, 2 to 3 weeks maximum you can use, not longer than it may cause toxicity. As such, if it often slowly it may get absorbed. So that is it's a raw area, already told, raw area or raw wound in the superficial wounds. The skin it is being used. It gets carmine red color on the surface once it gets dried up. It's still available in India. We use it very regularly, but for short period. Especially we use for superficial wounds in the skin and also in the grafted area in the recipient zone. Once you see the wound after 5th or 6th day, then you apply gently, small amount you apply over the area, and that will increase the epithelialization. And should not use longer time to avoid mercury toxicity. So that is why long-term use should be avoided. This point is very, very important. Don't use more than 2 to 3 weeks. This way it is banned in many countries like USA, Brazil, Germany, and France. Still available in our country. Problem is if it long-term if you use neurological and visual problems, renal damage. And again, avoid spillage. Because very deep red color, like blood it is, and spillage into the eye may cause visual damage. And another thing is, if you spill it into the clothes, it stains, and the stain will not be removed at all. So that is also you have to be careful while using this mercurochrome solution. Still we use it, but many countries have banned it. For short-term usage, still allowed and practice. Remember. So read further thing. You read my book, Manual of Surgery, reconstruction topics, skin grafting, to understand what is it briefly. So only use for short term. There is a point which you have to remember. So answer the MCQ. The forehead flap is fasciocutaneous flap, myocutaneous flap, osteomyocutaneous free flap. Students, please put the right answer in the comment box. I'll acknowledge and appreciate your answer. Another MCQ is modified cluster suturing is used in skin suturing, bowel, muscle tendon. Again, put the right answer. And also request, please subscribe my YouTube channel. It is free. Daily small brief lectures will enrich your surgical knowledge. Quotation of the day is, some people look for a beautiful place, others make a place beautiful. That is more difficult, but it's more appreciable. Make the place beautiful rather than look for a beautiful place. That is a self-explanatory, very good quotation. Remember, students, please go through my SRB's Manual of Surgery, SRB's Clinical Methods in Surgery, and SRB's Operative Surgery, Surgical Atlas. The new edition has come, and Atlas of Suturing Technique. Manual gives everything in detail about all topics as per CBM syllabus: general surgery, gastrosurgery, urology, neurosurgery, cardiothoracic, and basic instruments, specimens, brief operative surgery, which is essential for UGs. Everything is covered with the quotations, with the illustrations, diagrams, photos, covered everything as for CBM syllabus. And clinical methods in surgery, current edition gives a proper clinical idea, approaches to all cases, briefly orthopedic also. Again, it contains instruments, specimen, images also, and videos. Each chapter videos are there, how to examine a patient, which is very important when you do a practical exam, clinical exam. So very, very useful, everything, which again, lot of photos and proper methodology of examination with the differential diagnosis tables are given. So it will be very, very useful. Of course, operative surgery is a very detailed 2-volume extensive book with more than 10,000 photos and illustrations. whenever you want to, any surgery, including specialty, general surgeries, gastro surgery mainly, in detail it is given. It will be very, very useful. So students also go through my SRB's Surgery Insight YouTube insights, and please subscribe for all these lectures, daily lectures for brief 6 to 10 minutes, and live sessions once a week or once in 2 weeks I am doing. They're also very, very useful for students with very, very with the interaction with the senior faculties are there, and always they can answer your doubts and through chat. So please subscribe my channel, YouTube, Instagram, to have a better knowledge and increase your surgical knowledge as such, because it is free also. And my DigiNow lectures through JP, around 220 lectures covering everything surgery, including specialty, operative surgery, clinical methods also, with the videos through JP Publishers. And you can always purchase that one for 1 year, so that you can have go through the all lectures with a very clear idea about the subject to face any exam, including NEET or final year exam or even PG exams. So students, I hope you understood my lecture very well. Thank you so much.